Now, what is that? PCOS, they refer to it as.
Right. So polycystic ovary disease refers to insulin resistance, and it's actually not just a problem with your ovaries. It's really a hormonal problem that infects the entire body. And so some of the symptoms that you see with women with polycystic ovary disease is, as I say, insulin resistance. So they have problems with diabetes or pre-diabetes. They have problems with weight. They have problems with abnormal hair growth, and they have problems with ovulation.
So you developed this because of that issue with being overweight, your lifestyle maybe?
Nope, the other way around. So it's
Okay.
actually the insulin resistant leads to the overweight. It leads to the problems with ovulation. So it's an underlying metabolic problem, much like diabetes is an underlying medical problem.
Right. And how common is it?
It's actually quite common.
Really?
And we see it very, very frequently. And there are medications that we can use both to induce ovulation and to treat the polycystic ovaries.
Now, I'm sure many women are probably terrified, thinking, oh my goodness, this will not help my chances of getting pregnant. But can women get pregnant with PCOS?
Absolutely. So we have lots of medications. Both with lifestyle changes and with medication, we can get women to ovulate, and we can get them to get pregnant quite easily.
Okay. Now, there's also another hormonal issue called hypothalamic dysfunction. Did I say that correctly?
That's very good.
Okay. Now, what is this condition? How might it affect ovulation, doctor?
So by the same token, so the hormones there are hormones produced in the brain. These hormones produced in the brain will go down and will cause the ovaries to ovulate or to make hormones.
Okay.
So if you're not making hormones from the brain, from the hypothalamus, you're not getting any signals to the ovaries to make estrogen. And in that set of circumstances, if there's no hormonal production from the ovaries, you cannot ovulate.
Who's more at risk for this condition?
This tends to be a relatively uncommon condition,
Okay.
and most of these women present with no periods at all. So they'll come in and say, I haven't had a period in a year.
Which is not on the normal spectrum.
Correct.